The Waianae Coast is a beautiful place. It is on the western part of Oahu. The largest Native Hawaiian population lives here. But here at the Comprehensive Health Center, our goal is to go to where our community is. We listen specifically for me to the kupuna, the seniors.
Prior to our center being here, the closest was about 30 miles away. And if you can imagine, back then we didn't have paved highways. There was a time when our Native Hawaiian people were turned away from that hospital because they couldn't pay for those services. And so the founder of our community health center, Auntie Aggie, said, okay, well, then we're going to bring services out here. And that was 53 years ago. Fast forward into the technology world, and now you have telehealth. And I consider that as a way to bring healthcare, kind of that extended digital arm, right, to wherever our patients are.
By using telehealth, we can increase access markedly. And that access is a key because when we're able to see a patient, speak with a patient, that really is the key to healthcare.
So Dr. Bradley came and wanted us to do this self-monitoring blood pressure program with you because he's starting you on new medications.
We started implementing the self-monitoring blood pressure program kind of during and after COVID.
This one right here is just some information on what is high blood pressure.
We utilized our RNs to do an awful lot of patient teaching, and then we had some provider champions also. Patients were selected in the clinic. Somebody came in with high blood pressure, and the provider or one of the RNs would talk to the patient and say, hey, we have this program. We'll teach you how to use a blood pressure cuff. It's very easy to use. We'll do it right here in clinic. And our patients bought into it very quickly.
In the first year of this program, 5 years ago, we remeasured blood pressure on the participants of the program, and we found that by year end of the program, 24% of participants achieved controlled blood pressure. That was an indicator that this program is effective.
When we talk about telehealth, we have to actually use the word digital inclusion, and that really encompasses everything that you need to make sure that your patients can connect. It starts off with access, and then next is digital literacy. So sure, I can access, but do I know how to use my cell phone?
When we launched telehealth, they were all frightened by it. They didn't believe in it. They felt they could never learn it, and they wanted the old way of paper and pencil and face-to-face with the doctor. They were afraid of the technology.
So, aloha, my name is Jaffer the Crew. I'm here with Tech Savvy Teens, and today we're going over mobile basics. We're kind of get you guys more comfortable with your guys' mobile phone. So, Tech Savvy Teens is a program where we do one-on-one tech support for Kupuna. We also do presentations on hot tech topics such as cybersecurity, AI, and email basics. Teens like me and the younger generation is really familiar with technology because, of course, they grew up with it. And technology is moving kind of fast, especially for our kupuna. Getting people more comfortable with technology will eventually get them more comfortable in telehealth.
So when we talk about innovation, really at the heart of how our community is able to access and use telehealth, we've taken into consideration the fact that not everyone has a device or everyone has internet where they're at. And so we opened up a telehealth kiosk at our local grocery store.
But why a supermarket? And we get asked that question dozens of times. And it's because, one, that's the gathering place on the Leeward Coast. That's where everyone is at. You want to know the sale of milk or poke or a musubi, that's the place to be.
It's basically a one-stop shop. Patients can come in, see their provider virtually, get their prescriptions done and filled in the adjacent room right next to us, go grocery shopping, and you're done. Done deals, go home.
Key steps in implementing the kiosk was finding the right partners, finding the right location, the right space, and finding the right funders that'll help us bring this project to fruition.
So with all of the success, there were definitely a whole lot of challenges and some that we really weren't prepared for, but we were able to overcome. And we're so privileged and really blessed to have a really great partnership and the support from American Heart Association. They've provided us with the tools and support to be able to continue our progress in telehealth. Further starting or considering starting a telehealth workshop or any program, figure out what your community needs are. And that also means remembering your community culture. There's always going to be something that makes your community feel comfortable That's the only way that we'll be able to introduce and adopt new technology in our community.